Yes, I'll start with you, Commissioner Chow,
Present.
Vice President Guillermo,
Present.
and Commissioner Guggenheim.
Present.
Thank you. And before I read the land acknowledgement, I just want to say to everybody in the room and also who is participating remotely, please speak up and enunciate. The room in here has a weird air conditioner, so it's difficult to hear on either side. And if you can't hear a question, you all can't hear a question, or you all can't hear their question, please ask, because the room is just not set up well. Great. I will read the land acknowledgement now. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who were the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, which is the approval of the June 16, 2025 committee minutes.
The minutes are before us for approval. Is there a motion?
I move approval. Second.
And is there any public comment in the room on the minutes? All right, I see no public comment, so all those in favor?
Aye.
Aye.
Thank you. The minutes are approved. We can move on to item 3, the monthly contracts report.
Good afternoon, Commissioners. I am Kim Baker. I'm the Director of the Office of Contract Management and Compliance for the Department of Public Health. I'm probably the newest member of the family. I've been here about 5 months, and I'm going to be handling this responsibility of going through the monthly contract report for you each month and coordinating all of that information with our Director, Dan Tsai. So today, we have, fortunately for you, a short agenda. We have 2 items on the monthly contract report and 2 items that will be presented as new contracts. So I'm going to walk you through the 2 on the monthly report first. And the first thing I wanted to let you know about these 2 contracts, and the reason why the contracts are here, is because both of these contracts fall under Administrative Code Chapter 21.42, which is our sole source code for health-related contracts. And the reason why this is important to point out is that we've been in some conversations with our legal department recently, and they want to make sure that when we do a contract under 2142, that we make it really clear to the commission that that's what we're doing, why we're doing it. And then you actually make a recommendation that you're good with us actually using that particular part of the code to continue on with these contracts. So, and I'll explain a little bit more when we get into the contracts, what exactly that means to each contract. And I did also want to let you know that we are still working with legal on an appropriate process for this 2142 use. And because those rules and procedures aren't quite worked out properly yet, Michelle will bring back a full presentation to explain what the changes are going to look like in the future for the use of this particular code. It's been very useful to DPH because it allows us to move into contract very quickly on very critical health care needs. So we're going to work real hard to try to retain the ability to use that code so that we can continue to provide quick services. Okay. So the first contract that is on your monthly report is a 6-month extension to HealthRight 360's fiscal intermediary contract, also known as a program administration contract. The contract provides support for specific DPH behavioral health related programs. There is no change in the contract value, and the annual amount will be reduced based on the fact that we've brought a lot of this work in-house over the years. So there's not as big of a need for this contract as there was in the past. The 6-month extension allows time to complete a new solicitation, a new contract, and that new contract will be brought back to the commission for approval in just a few months. We're heavily involved in trying to get that done now. Since this is a needed extension to the current contract to continue services during this transition, is considered a sole source because it has to be with the same company, obviously, to continue the services. So we are using 2142 to continue these services for 6 months. So are there any questions on this particular contract?
Commissioners? Commissioner Guillermo?
Thank you for your explanation of this one. Just wondering, so when this contract is over, is there another authorization that is in process, or are these all going to be taken in-house?
Yes. So when this contract is over, there will be a new one replacing it. It will be at a much reduced level from where this one was in the past. And we will bring that back to the commission for approval in just a few months.
Okay. So,
Commissioner?
and that's being, I'm sorry, and that is being, is that going to come to the commission before it goes out for solicitation, or?
After it's solicited and we have a new vendor selected, that's when we would bring the contract back.
So we won't know what the new solicitation is, sort of the scope of that prior?
I don't know how you traditionally handle that, seeing any scopes of work. I don't know if that has been a practice in the past. But it is very much scaled down from this particular contract in providing support for our different programs.
So I was just wondering if it would come as a part of the contracts report or as a new contract?
It will come as a new contract. Mhm. Okay.
Commissioner
Yep.
Guillermo?
So I'm not sure this is a very smart question, but it seems to me that the figure 9,900,000 is for both the current contract term, which just goes through 6/30, and for the proposed contract term, which goes through 12/31.
That's a very good question. I actually asked the same question myself. And so it's a good question. It really just means it's not changing. They're not asking for any more increase to the contract. They'd normally spend, as you see in the column a little bit further over to the right, they spend about 3.3 annually. So they're only going to spend, it looks like, just a little over $1 million for this next term, this next cycle. So they're not asking for any increase to the contract value. It's remaining at 9.9 where it is today.
Thank you.
You're welcome.
Could you then once again explain about 2142?
Yes,
Because this is fairly simple, but
yes.
how does it operate? Is it on, because, and how do we know that it's only, that it's the sole source when you use it? Now, in this case, as you said, if we're extending the contract, obviously it's only one contractor that's being extended, but what would say that that's the operative article that you're using?
So that's a really good question. And I know Michelle's going to get into it a lot later, but basically 2142, I believe, I wasn't here at the time, but I believe it was created as an opportunity for DPH to move really swiftly when they needed to set up a new health service program or they needed to continue a health service program where they didn't really have time to go out and do a formal solicitation, go through those months of that process. It was something that was urgent in nature. And so they were allowed by this administrative code to select a nonprofit that had the best ability and capacity at that time to go ahead and set up and start running that program. And until such time as staff had time to kind of catch up and do a solicitation and actually pick a vendor and so forth, it got it off the ground and got it started. So it's been used quite a bit. And the attorneys, just naturally so, wanting to protect the city's interest, right, just believe that we need to be more intentional about it. I think what we've done in the past is we've brought you a big long list of all the nonprofits and we've said, hey, commissioners, we might use any one of these contractors, these nonprofits to stand up a new program. Will you approve this list? And you said, I understand. Sure, I'll approve the list. The nuance is the attorneys are saying, it needs to be more intentional than that. You need to take it contract by contract, and you need to state your case for why that is a unique situation and why the commission needs to say that it's okay to go forward with that. So just a little bit more intentional in the ask to say to you as the commissioners, this is why I'm asking for this. Are you okay with me using this code and basically bypassing some of the procurement processes? Does that make sense?
Yes, it does. It's a
Okay.
very good explanation. Thank you very much.
Yes, you're very welcome. Okay, are we ready to move the next one?
Yes, please.
Okay, so the next one is basically the one we call the AmeriCorps program, and it's a really, really good program for DPH. So let me explain a little bit what's going on here. So this is a new contract, but it is for continuing services. It's for $385,440, and it's to continue services through San Francisco Community Clinic Consortium, who administers the Community Health Corps program under the federal agency AmeriCorps. So the AmeriCorps program links medically underserved populations to community health centers in our city. The program provides healthcare workers to assist our clinics and provides the workers with training, development, and some living expenses. We have 11 workers that provide annual services at our clinics. That number varies per year depending on funding and so forth, at a cost of about $30,000 per worker. That's a bargain, right? We get a healthcare worker for $30,000. This service has been continuing for several years, and each year a new contract is developed, and that's just based on the requirements of the AmeriCorps program. So because this is a unique service that can't be procured, it is being presented under Administrative Code 2142 as a sole source. And I just talked to the business owner about this before the meeting, and she said, unfortunately, they're probably going to lose a lot of funding this next year. So we may not have the opportunity to do this in the future, at least not to the level that we have to date. It is a retroactive contract because we spent a lot of time trying to sort out the contract and figure out what the correct approval authority was going to be. They tried to send, I think, a sole source through some of our other channels, and they didn't look at it as a sole source. So it just got messy at trying to get the contract approved. But we are asking to use 2142 to continue these services for the remainder of the year. This contract actually expires at the end of September, but it has been extremely beneficial to DPH. Any questions?
Commissioner Jess.
So again, thanks for that explanation. So since this is a retroactive contract that supposedly started last October, have the services or have the health workers been hired, and are they operating, and how are they getting paid if this hasn't been?
They
approved?
have been hired, they have not been paid. And that's been one of the urgencies about trying to get this contract to the Health Commission, is that we were delayed. There was a misunderstanding that, about this, who could sign off on the contract. It was just a lot of things that happened last year that caused it to not get approved in a timely manner. And so that's why we're here today, trying to get it approved so we can go ahead and pay their invoice. Typically you pay the money up front. And fortunately, AmeriCorps and this whole consortium group has been carrying the water on this until we can pay the bill.
Oh, okay. So the workers have been paid. It's just
Yes,
we
need to
now
reimburse them.
Reimburse. Okay.
Mhm.
All right.
Yes.
And then I know that this program may not be continued given the federal cuts, but given the misunderstandings or the confusion in the past about this, and this has been a longstanding program, can you just explain a little bit more about why and how it took so long, given that this is a program that's been around for a while?
Well, I think there was just a lot of misunderstandings. I think the business owner thought they had signature authority on it and they had signed off on it, and then brought it to our group, the contracts group. We looked at it, got concerned about the signature, and started working with the attorney on that. And then they also started working with our Office of Contract Administration, who has to approve the normal sole sources, not sole sources under 2142. And I know that gets a little bit confusing, but if you just declare something a straight sole source, say they're the only ones that can provide the service, it normally goes through that process for approval. They had concerns about declaring it a sole source under their codes and regulations, so they pushed back. So it took a while to sort it all out between the different departments within the city, with the city attorney's office, on whether we could use this 2142 to actually get the contract approved or not. And we just got all of that sorted out. Just as quickly as we got it sorted out, we had it on the agenda for approval. And certainly not something we like to see happen, but something that just happened. And I've been digging into that since I got here about what's happening. I have a meeting with our Kaizen group this week who's trying to look at the length of time it takes to certify contracts with the city. It's an average of about 200 days to certify a contract right now. And so we are going to be working very diligently to try to see what we can do to reduce the timeframes that it takes to certify a contract and get as far ahead of it as we can so that it doesn't come to this type of state.
I really appreciate that detailed explanation, and I would request maybe that as this gets worked out, ask the chair of the committee if we could get an update on
Absolutely.
the progress of that at a future meeting.
Would be happy to do that.
Yes, I think that's reasonable. As a matter of fact, that's what I was going to suggest, that we receive an update
Yeah.
to understand this whole process. While I have floor here, could you explain that since this was a federal program,
Yes.
it says it's 100% general fund that's funding this?
Yes.
We're funding the 28,000 per member
Yes.
to the Community Clinic Consortium.
Yes.
Now, are so what does the feds contribute to this? And therefore it can't just be administrative, right then?
Right. So I don't have the exact numbers, and maybe Carol can get on and answer, but I do believe that there is money passed through the federal part through AmeriCorps that we don't see, that picks up a portion of it, because obviously $30,000 to cover, the wages and the living expenses. And I think they pay for their health care. It's quite a bit of stuff to pay for $30,000. So there has to be another piece of it somewhere, which I assume comes through AmeriCorps in some term of some type of federal grant that pays for part of it. This is just our portion of it that we pay through the consortium. And we can get Carol on if you'd like to
And,
explain more.
Would you like there's a staff person who can possibly give more information? Would you like that?
Yes, I'm wondering what the 32,000 contributes, and 32,000 monthly per member. No, it's 32,000 per year.
Yes, per member. There's 11 members.
Okay, so
Mhm.
it's even more interesting to see how that
Yeah.
comes about, because that's only about a little under $3,000
Yes, agree.
for, so it'd be interesting to know what the 3,000 does versus whatever the federal match is. Not
Right.
match, but the federal program is.
Carol, I've unmuted you. Can you let us know if you have more information on the federal portion of the funding for this program and contract?
Sure. I don't know the exact dollars, but this is a federal program that is actually used across the nation in many areas, not just healthcare. It's really about building a pipeline for young people to have job experience in different fields. And so the AmeriCorps is a program that's run by the feds in many entities across across the nation. And we pay $32,000 per worker. And actually that doesn't come out of general fund. We use that out of our PIP funding, our PIP funding is the pay for improvement services. So those are things that we get paid for through from the state through the health plan around making sure that we're making our healthcare improvement metrics for our patients. And so we generate revenue through that, and we use that revenue to help pay for some of these services because they are directly linked to helping us meet those metrics, right? So for instance, in primary care, we use them for our food pharmacy program. We use them for our dental outreach. We use them for, in our value-based care program, really looking at the data and helping us do outreach to patients. In our whole person integrated care program, we use these folks to be doing like care management services for Hep C, HIV, substance abuse tracking, shelter health. They do a lot of health education and coaching with patients. So these are the kind of services that these workers are doing. And at the same time, they're gaining valuable experience for their career pipeline.
Oh, very good. That's quite an explanation and one which I hope we're not going to lose out on because it sounds like
Right,
they're really
right.
pilot. Commissioner Guggenheim. Oh, no questions. Okay. Shall we accept the contracts report then at this point?
Well, and I'll note there's no public comment on this item.
Oh, okay.
Oh,
Okay, so, so I'll move approval of the, or,
Contracts report. We need a second for the contracts report?
All
I
right.
recommend to the commission. All those in favor, please say aye.
Aye.
Thank you.
Thank you very much, Kim.
Sorry, I didn't catch up.
Item 4 is request for approval of a new professional services agreement with Progress Foundation.
Good afternoon, commissioners. Can you hear me?
You have to speak kind
Got
of.
it. Got to get really close. Good afternoon, commissioners. My name is Emeterio Garcia. I'm the program manager for mental health residential programs for BHS. I'm here to propose a new contract for what we're calling enhanced dual diagnosis. This project aims to expand our continuum of care by having more year-long mental health residential treatment for folks in our system. We are pursuing this under the bed ordinance of 21A.4 to ensure that we could work quickly with the provider to support them in procuring a property to execute this service. A little bit more about this service. This specific type of service would be a social rehabilitation facility licensed by Community Care Licensing that would provide 1 year of treatment for people who most commonly are exiting locked facilities, the jail system, inpatient psychiatry, and people who just have chronic mental illness with substance use needs. This is a little bit different than our existing services is that we're intentionally supporting the provider to have more dedicated prescribers on their staffing by increasing their FTE of nurse practitioners and also some staffing. So due to this, the budget for this project is a little bit higher than our traditional year-long programs. It also reflects just a change in the real estate market. Progress Foundation has been a partner with BHS for over 30 years, and they run, as I said, 2 similar projects, Clay House or Clay Street, which has 16 beds, and Doreen Loso. Clay Street's been with us as part of the DPH family since 1996 and Loso in 2007. This specific level of care is probably our most sought after and most utilized level of care in mental health residential, specifically for conserved populations. On a given average day, the wait time for this project could be, for a bed at this level of care, could be 45 to 60 days. As I said, this is one of our first expansions in this level of care in many years, I think in about 18 years. So we're super excited to bring this forward. The initial cost for this project in 24-25 is about $84,000. This is really to support the provider in acquisition of the property so they could do their due diligence. And then beginning in 25-26, we're estimating a $2.4 million budget that includes continued startup costs and some direct services. The startup costs include renovations to a building that they will find and renovate, and also ensuring that they have what they need to hire new staff for that project. With a total, and this is a short-term project contract through December of 2027, just to give us more time to get the project up and running, and then formally bring it for formal approval at a later date. I'll pause here if there's any questions. Also here on standby is the executive director of Progress Foundation. Should there be more questions about the service modality, and I'm also here happy to answer questions about the system of care.
Commissioner Guillermo.
Thank you for your presentation. Could you let us know how many existing beds of this type do we already have?
Yes, currently we have 30 beds of this type of care in our system.
And what is the goal for this number of beds, or the total number of beds, to sort of bring that waiting list down? Is
I-
there-
I don't have it off the top of my head. I think the last study we had for this was many years ago, but I believe at that time we were pursuing through the MHSF dashboard. I don't know if you're familiar with that. We were pursuing, I believe, 30 dual diagnosis beds. This gets us halfway there with an additional 16, and the 16 being a little bit fluid because it will be contingent on how many beds could be actually licensed at a facility through community care licensing. But we're estimating it'd be somewhere between 14 and 16.
And is the reason that the expansion hasn't happened prior to this is real estate issues, or programmatic changes, or budget?
It's been a mix. We've been working with Progress on this project for about a year, and it's just been the real estate market, properties that just were not feasible, things of that nature. And also part of it's also been the resource on the behavioral health system team, service team, from us to have dedicated staff to support them in moving forward this contract. We also got derailed, not to say pandemic, but we got derailed by the pandemic on this when we initiated this a few years ago. And then we kind of unfortunately had to shift two other priorities, or fortunately two other priorities that were more pressing projects.
Thank you. And last question. So the first part of this contract is to so that Progress can identify a facility and do all of the sort of setup. Has any, given that this gets backdated to June 1, right? So just wondering, are there identified facilities, locations, and other sort of supports for that have been identified?
They have. Unfortunately, we're not at liberty to discuss. They're still in negotiations for the property with the proposed seller, but they have been in discussion with the supervisor of that district and other parties of DPH and the city to notify them of a potential site.
Okay, thank you.
Commissioner Guillermo.
So it says transitional residential treatment. Does that mean transitioning from something more strict and locked up to this, and then from here to something even less?
That's correct. That's correct. In the social rehabilitation licensure, it really breaks down really two modalities of care. One is crisis residential, meaning it's serving people who are coming directly from a crisis. Think psychiatric emergency, door urgent care, 8292 Geary. And then transitional residential is really focusing on helping those individuals who are coming out of that crisis continuum get practice skills to get to that next level of care, whether it's supportive housing, whether that's a boarding care home, whether that's a return to independent living. This project is intentionally a year long, which is different than our 90-day programs of this capacity, to serve people who are a little bit more debilitated by their mental health illness.
So no one would come into this directly from the street. It would be people coming from, okay,
That is correct.
thanks.
Thank you. Question I had was, under the initial year, you did have 2.4 million in addition to the 84,000 that was in June of 2025. So it's sort of the same question Commissioner Guillermo also had. And it kind of recalls when we had our meeting where we went through this in the marina, where there was a site, and then we had to look at a contract similar to this saying they're going to deliver services. So now in this case, we're getting a contract to deliver services with no site. And yet also you've put out that in this first year, we're also somehow going to, and so your timeline says somehow you're thinking that we're also going to expend 2.5 million in services. So what is sort of the a framework upon which you've written this so that, I mean, is it like within the next month or two, we think we're going to get a site and then you're going to build it out for a third month and we're going to then spend 2 million for the remainder of that first year? Or somehow I'm losing the ability to understand how we give a contract when we don't have a site, and then how we are then also then putting in money to deliver care when we don't have a site.
Got it. Well, with the first section is really for 24-25. As I stated at the beginning, the effort, a lot of this money is the money we're going to pay the contractor who's been looking for a site and working with real estate to do due diligence, testing, things of that nature for the site. So that's the first section that you see there.
Yeah, that's
That-
the
that-
84,000.
Yes.
Okay.
Whether that will all be invoiced is to be determined. And then in the second year, we were originally intending, as I stated, we have identified a site to kind of also pay for renovations. That's what part of that. Not to pay for renovations, but to pay for the initial rent for that site. And we were expecting services to be delivered a little bit earlier. Now that is a little bit in flux because we were anticipating a site to be secured a lot earlier in this contract, but we kind of did get stuck in a little bit of a chicken or the egg situation where we wanted to ensure that our provider had a contract so that they can go with their parties to ensure they could secure a site with funding in their account for the purposes.
Okay, so you don't really know, but since it is a fee-for-service contract, in case you never do have the services available in the first half of the new year, we will actually not expend the 2 million that you're asking for in that first year.
So sorry, Commissioner Chow, I couldn't hear the last part of that question.
Okay. We're putting in 2.4 million, which includes some sort of services. But because this is a fee for service, if we don't have those services, we're not going to expend it, right?
We won't be expending the full amount, but we are doing cost reimbursement for the first year, like we typically do for most of our projects, to ensure the provider has adequate funding to hire new staff. And also because in these types of programs, the census kind of slowly increases. But the other contracts of this nature that we have are fee for service based on the amount. This was added to the budget to kind of give us an estimate of what our costs could be in that first launch year. But again, it's really going to depend on what our actual expenses are and also what the cost reimbursement is required for the provider.
Right. So the real answer is if we don't have people there, we're not paying for them.
We will be paying for operational costs that have to do typically with rent and things of that nature that happen in our services, and in our projects. But if the staffing is not fully hired and things of that nature, then that tends to be a cost savings for us.
Okay, well, that was very clear in here. And you know, you had, because there's a big request here, I'm just looking at the process. In terms of helping to clarify when we're writing this down. If we don't have a site, we're still looking for a site. In fact, you lay out a whole bunch of items on here, and yet it looks like we're asking for a full year of, nearly a full year of service, because that's the annual cost, including operations,
Correct.
of the following years. It isn't clear to us, or at least to me, that we're I mean, it's possible, and I don't think you're going to spend 2 million on operations, but this sort of says you could.
No, I
Because
understood.
you just told me that we wouldn't be paying fee for service, but we'd expend a budget. So wouldn't it have been more appropriate to somehow estimate what the operational cost might be? And then the remainder of the 2.5 would be a fee for service type contract. I mean, otherwise it sounds like we're also actually giving a contract that allows that we could spend 2.5 million on operations in the first year.
Yeah, I hear what you're saying. I think part of the reason why we budgeted at this capacity was that originally we were anticipating to have the property secured a lot earlier. So we were anticipating more of a full year of service for this initial year. But to your point, typically we probably could revise this a lot better.
Commissioner, so is based on what Commissioner Chow is asking, will the DPH staff be monitoring this to do the best they can to be fiscally responsible so that $2 million won't be spent on just operations and trying to get services going?
Yeah,
I
absolutely.
think that's what they're working to do.
Absolutely, yeah. We will be looking at their costs on through their invoices directly to see what's operational, what's staffing, and to see what's actually utilized and what's not utilized. And at a certain point, when the services become online, we will also be requesting Medi-Cal reimbursement for these services, which is another portion of this why this is a big estimate at this point.
Well, I understand the overall estimate. I just think that on the specific in terms of trying to understand what is going to be sort of authority, that it doesn't just rely upon somebody who thinks it's nice to put marble on the walls.
But would it be possible then to get an update on the acquisition of the facility prior to operationalization? And then have a better sense of the expenditure from that point on.
Yeah, that's totally feasible on our end.
How would we do that?
If we could get an update from.
You get a follow-up on this. Matter of fact, that would be very good. We can get a follow-up on where the project is and how much the project is at this point costing. Then there would be a return accountability, if that's possible.
Yeah, it'd be my pleasure, Commissioner.
Okay, thank you. We'll do that and note that.
Okay.
The contracts before us, and with that modification, that we'll get an update so that we understand when the project's going to occur and when we will be able to, take patients. Our motion would be in order to recommend this to the commission if it's your pleasure.
So I would recommend approval to the commission with that modification on the update.
Second.
All those in favor?
Aye.
All right, thank you
Aye.
very much. We can move on to item 5, request for approval of 25 new Chapter 6 contracts for as needed facilities and maintenance services. And just noting that it is 340. Come on down.
Good afternoon, commissioners. How are you guys doing today? My name is Chauncey Jackson. I'm the Deputy Chief Operation Officer at San Francisco General, and I'm going to be presenting Chapter 6 contracts to you guys. This is a service that is a facility-based service for emergency, unplanned issues that happen throughout DPH, whether at Laguna Honda, the clinics, 101 Grove, and also San Francisco General. There are 25 new contracts with 16 different vendors, 2 additional trades. Some of these services are roofing, electrical, shading systems, switchboards. And so I always like to give a story. One of our water mains broke at San Francisco General in the middle of the night, and it was because Chapter 6 authority allowed us to put together an emergency contract to have somebody come out to prevent that from happening again. Again, this is not this is a spending authority. So there's no set amount or minimum amount that the vendor has to use. Right now, ZSFG is a primary user of this, but also can be used by Laguna Honda. ZSFG last fiscal year used 73% of this service, with Laguna Honda and 101 Grove a little under 3%, with primary care at over 20%. And so this is used by all, but it runs through my department at the facilities and contracts facilities contract at San Francisco General. It goes through me for approval, and then we keep all the numbers and data for the last 5 to 10 years for each vendor, as some vendors can have separate trades. So you may have one vendor and they may have electrical, low voltage, roofing. So that's why in here you'll see one vendor but named separate times, because they offer different services.
Commissioner Guerrero.
So if I understand you correctly, this is kind of an emergency list. In case an emergency happens, we are giving you permission to go to XYZ electrician, plumber. And if we didn't, you couldn't.
That is correct. We have staff on site, but these are large large emergencies that one or two staff cannot handle. And then also at the same time, this allows us to not have to go through DPW, which takes a long time, which is project work. So again, there's been water main breaks or a collapse in the roof. And so we have to do the work. And this allows us to do that work.
So,
Commissioner Guillermo.
So just a procedural question then. So then if there is this master contract per company or for the type of service?
So you'll have like there'll be one trade, like low voltage. That's the trade. And then you'll have several different vendors under that trade with a set amount for 5 years, right? And so we're not to go over that set amount for the 5 years. These vendors, depending on the trade, will allow us to do the emergency work.
So the master contract includes the list of those
Yes.
vendors, and then you just decide.
Well, there's a process. There's a process. It goes out to like an RFQ. They submit quotes, and then we do the work after that. We don't just select unless it's only one vendor. We don't just select, hey, let's go to this vendor only.
And if it's an emergency, wouldn't that require a quick turnaround time then?
So in emergency situations, we are on the call, like water main break, we are on the call with PUC, we're on the call with the vendor. These vendors also have sometimes contracts with the city. So we have relationships with all of these vendors, contacts that we can reach out to in the middle of the night for this very thing. And so we can always contact the vendor. Hey, we need a quote by 8 a.m. Most of the work that is emergency can be done by like a PUC if it's a water main break, but then it's the work to prevent this from happening again. And that's the work where we need our vendor.
So then I'm just sort of wondering in terms of the just the relationships, I guess, that, when given some of the things that have happened, that there is a arm's length relationship between the vendors and anybody in the position to select.
No.
Yeah.
So it's a process. If it's 5 vendors, all 5 vendors get reached out to, all vendors submit through contracts, then those quotes are kept, and then there's a process. So we speak to this in the memo, but there is a process. There's no, I call vendor at midnight, hey, can you come out and do X work? Actually, most of the work that's an emergency that does happen is city agencies that are doing it. This again is for preventative unplanned. And then we work with our contracts office for that. So it's I have the relationship with the vendor, but because our vendors are San Francisco General has a whole bunch of projects, whole bunch of vendors. So if there's an issue, most of them are already on campus. So they can also, okay, what's the problem? I'll reach out. I'll work with contracts on getting you a quote in the morning. Then we go through our normal process.
So it's just this balance between getting sort of stripping the bureaucracy, but also making sure that there's
Yes. Yep.
there are
Processes,
Yeah,
yep.
okay.
Mhm.
Great. Thank you for that explanation.
No, thank you.
Any further questions? If not, a motion to recommend this list to our colleagues?
I'll move to recommend approval.
All those in favor?
Aye.
Second it.
And I'll note again, there's no public comment on this item. Thank you very much.
Thank you. You all have a great evening.
You too.
Thank you.
Item 6 is emerging issues. Hearing none, and also any public comment on that item? No public comment, and we have item 7, which is public comment for the Finance and Planning Committee. Any public comment for that? General public comment? No public comment, so consideration for adjournment.
A motion for adjournment, it's in order.
Second.
I'll move-
No, you
I'll
made the
second.
motion.
You moved. I'll second this time.
All those in favor?
Aye.
Aye.
And I just want to acknowledge and thank everyone who presented today. Everyone was really clear. The explanations were wonderful and like really met the commissioner's needs, and it ran really smoothly. So thank you for all the good work.
Yeah,
And the
I
prep-
agree.
Thank you. Yes.